Okay, welcome to week number 4. This one we're going to go over a knee case study. In the case study, just going to read through it. It's a 23-year-old female who has lateral anterior left knee pain about 20 days ago. And read through the case study itself. We'll get through the components of it. Thoughts, the severity. If you look through it, it's moderate. She's not able to do her normal activities, which is key. And there's a pain level that is kind of on the moderate to high side, between 4 and 6. Her irritability is moderate. Doesn't take tons to make her irritated, but it doesn't happen right away with activity. Nature, this is a knee pain. If we put it in a classification, we consider knee pain with chondral defect. And if you look through other red flags, and if you look through it, she has constant pain, which could be a red flag. You want to ask more. Is it constant? Is it more constant, variable? From there, we'll go on and see that she had trauma, but she had no x-rays. That's one of the things we start to think about. And according to the Pittsburgh knee rule, she should have had some type of x-ray with that type of trauma. Objective exam. Now, key point to get this is make sure that your students are starting to do more of the objective component of it. As we go through it, you'll notice range of motion. She has limitations in flexion and extension, which is one of those things that really, chondral defects is one of those hallmark signs of some type of chondral defect. You'll have them go through the range of motion, practice the palpation, practice the glides. The glides are important for especially meniscal or lateral glides to the tibia. They're the key one. Go over the special tests, have them practice each special test. And from there, you're going to go over treatment options. And again, we talked about early on, pain inflammatory control, angiotherapy, Therex. So if you go through it, what you want to look at is what kind of mobility things, if it becomes a mobility component of it, what kind of glides can we do? So practice AP, PA, maybe medial rotation, medial lateral glides, etc. Go over any soft tissue techniques you find appropriate, and remind your student going through the stability and strength by position, etc., through surface, through planes of motion, and then progress. We go from 2 legs to 1 leg, 2 legs stable, 1 leg unstable, etc. So the key to this one is start to have them think of your thinking process. How would you go through the patient? How would you get them through the more, not quite acute for this case, but subacute and chronic? You can bring them through somebody from acute to subacute to, later on in rehab where you start to get them to move a little bit. All right, that's week number 4. As always, make sure they take some time and tell them that the next week is cervical, have them review. You can even give them the lab manual